Hi, I'm Sutaria, and I am an assistant professor of internal medicine at UT Southwestern Medical Center. And I work at our county hospital, which is Parkland. I'm a hospitalist. Thank you so much for listening to my poster. I'm the course director for our Transitions to Residency course, which is also called Residency Essentials at our institution at UT Southwestern. And I've been the course director alongside my colleague, Dr. Sean Long, who's also on this poster for the last 3 years. Initially, the course was optional with a class size of 20 to 30 students, and now it's mandatory where we have 160 medical students in the internal medicine track that we direct. I'll get straight to our curriculum. Interns are expected to cross-cover, but they lack formal training, and cross-cover requires gathering pertinent clinical information quickly and making quick clinical decisions on patients they're not familiar with. And this can be prone to medical errors without adequate training. Program directors expect 4 core skills from new interns, which is recognizing sick from non-sick, managing time wisely, asking for assistance, and communicating effectively with healthcare teams. And cross-cover tests these core skills simultaneously. A survey of the 4th-year medical students at our institution indicated that around 74% of students had received no formal cross-cover training. So we designed a sim-based cross-cover exercise for the 4th-year medical students. And the objective was to have students address common cross-cover scenarios and determine need to respond to a page in person versus on the phone. So I'll get to how we did this exercise. 125 4th-year medical students were split into groups of 4 each. They worked with 2 faculty, one acting as the nurse and another directly observing. Each group of students received a written sign out in iPass format on 5 or 6 mock patients. 5 cross-cover pages were presented to them sequentially, one at a time, on a PowerPoint slide. We wanted to actually send physical pages on their physical pagers, but that wasn't an option. And out of these 5 pages, one of them needed bedside evaluation because it was a crashing patient who was hypoxic, but the rest of the pages could be answered on the phone. So once the students received the page on the PowerPoint slide, they were expected to call the nurse while on speaker and determine further management. Each student took turns answering pages while the rest 3 observed, but they could all discuss amongst each other and then come to a conclusion on answering the page. At the end of each page, we did a debrief, and each group debriefed with both the observing faculty as well as the faculty playing the nurse. And what we did was we surveyed the students at the end of the session, basically asking them a comfort level question on a scale of extremely comfortable to extremely uncomfortable. And also the survey had a free text section where students could comment on things that went well and things that went poorly. So at the end of the session, approximately 62% of students felt comfortable in responding to cross-cover pages, and an additional 6% felt extremely comfortable in responding to cross-cover pages. Around 20% were neutral. And we also asked them their comfort level in making the triage decision, whether to see the patient in person or answer the page on the phone. And in regards to this question, approximately 66% of the students were comfortable in triaging whether to see a patient, whether to respond to a page in person versus on the phone. And an additional 12% were extremely comfortable. More than 94% of the students agreed the cases were relevant, and anywhere from 86 to 100% of the students agreed that facilitators had excellent medical knowledge and were open to questions. I have shown a thematic analysis of the student comments, and they were the themes that stood out and themes that went well were students consistently noted that the cases were realistic, facilitators were very supportive and created a great learning environment, and the simulation format itself was very conducive to learning. And I'd like to read one of the comments from the students, which said, "I thought this was one of the most useful activities I've had in my 4th year of med school. This was the best run simulation I've ever done. The learning environment was supportive and we felt comfortable making mistakes, asking for help. I wish we could do more of these sessions." And in terms of the cases, one of the students wrote, "The variety of cases was excellent. Each one felt realistic, especially with the format of calling a nurse. I appreciated that we had time for group discussion before each student returned the page." In terms of themes that could be improved upon or went poorly was time management per case. A lot of the groups felt they did not get enough time per case to solve the page. They requested additional time for future sessions. And some of them also commented that prep material beforehand would be helpful. But in conclusion, this was a very well-received exercise, and particularly they found practicing in groups in simulation format and evaluating a crashing patient bedside very valuable. The limitations are the need for faculty manpower, especially for a class size of 160. We did, due to the COVID pandemic, our class size was cut short and we could do this session only for 125 medical students. And out of them, basically 96 responded to the survey results, which are displayed. But this activity can easily be adopted by other specialties and other institutions. And I am very happy to share our cases, and happy for any questions. And thank you so much for listening, and have a great day.